Welcome back, focused learners, to today's explainer. When we talk about fighting cancer, we usually picture, I don't know, futuristic surgical robots or incredibly expensive miracle drugs, right? But today, we're looking at a massive paradigm shift that pretty much throws that entire assumption right out the window. It's a concept we call the prevention pivot.
When we hear the word cancer, our minds almost automatically jump to the end of the timeline. We think of hospitals, intensive care, that desperate race for a cure. It's this deeply ingrained assumption that to beat cancer, we have to treat cancer. But what if that whole assumption is just fundamentally backward? What if our absolute best, sharpest weapon against this disease isn't a cure at all, but rather an invisible shield built way before the disease even takes root? Definitely keep that idea in the back of your mind as we move forward today.
Okay, let's dive into this. Our roadmap today covers 5 key steps. First, India's cancer crisis. Second, the costly treatment trap. Third, the power of prevention. Fourth, executing the pivot. And finally, the road ahead. Let's get right to it. Kicking things off with Part 1, India's growing cancer crisis.
To really understand the solution here, we first have to respect the sheer scale of the problem. India is currently facing a staggering volume of cancer cases. We're talking literally millions of new diagnoses every single year. It's kind of like a dam holding back a rapidly rising river. At a certain point, no matter how strong your healthcare infrastructure is, the sheer volume of patients is going to completely overwhelm the oncologists and the hospitals.
Now, what's really interesting and honestly quite alarming about this is the fatal flaw in the current system. A massive 85% of cancer cases in India are caught in the late stages. 85%. To put that into perspective, it's the equivalent of trying to put out a forest fire when the entire mountain is already ablaze, instead of just stomping out the very first spark. Late-stage diagnosis means the disease is way harder to fight, the toll on the patient is infinitely higher, and survival rates just plummet. This massive imbalance? That's the actual root of the crisis.
Which brings us right to our second section, the costly treatment trap. So because the vast majority of cases are caught so late, the system is basically forced to rely entirely on reactive, highly aggressive treatments. We're talking massive investments in heavy medical machinery, super long hospital stays, and incredibly expensive chemotherapy regimens. And this creates just a crushing economic and systemic weight. Think about it. If your only strategy is to wait for people to get really sick and then try to save them, you aren't just fighting a medical battle anymore. You're locked into this cycle of infinite expenditure. It's an unsustainable trap, and it absolutely bankrupts both everyday families and massive national healthcare budgets.
When we contrast these two paradigms directly, the logic is just undeniable. The old treatment-focused way, it's reactive, highly expensive, and, quite frankly, too late. The alternative, a prevention focus, is proactive, low-cost, and steps in early. Why on earth would we pour all our resources into the hardest, most expensive part of the battle, when a tiny fraction of that cost up front could prevent the battle entirely? Makes sense, right?
This leads us directly into Section 3, the power of prevention.
Here's the core definition of what we're actually unpacking today. The prevention pivot is a strategic shift away from reactive, late-stage medical treatment toward proactive, early-stage public health interventions. It's all about building that invisible shield we mentioned earlier. It means realizing that public health policy, basic education, and community outreach are just as critical to curing cancer as a scalpel or an MRI machine. Basically, it shifts the entire battlefield away from the hospital ICU and out into the community, and that is where we actually have the upper hand.
So, what does this invisible shield actually look like on the ground? Well, it's not magic. It's highly actionable public health science. First up, routine screenings to catch any anomalies super early. Second, empowering folks to make everyday lifestyle changes. And third, preventative HPV vaccinations, which incredibly can literally eliminate the risk of cervical cancer before it even begins. These are small, incredibly cost-effective actions, but when you scale them across 1 billion people, you create an absolutely impenetrable defense.
Okay, so how do we actually pull this off? Let's move to Section 4, executing the prevention pivot.
This all builds into a cohesive 3-step national strategy. Step 1 is public awareness, meaning educating the population to dismantle the stigma around the C word. Step 2 is mass screening. We need to take accessible clinics directly to both rural villages and urban hubs. And step 3 is rolling out aggressive vaccination programs, basically treating the HPV vaccine with the exact same urgency as standard childhood immunizations. You layer these 3 steps together, and you completely transform the healthcare landscape from the bottom up.
Which brings us to our final section, the road ahead.
If India can successfully execute this pivot, the long-term outcomes are, frankly, game-changing. First off, healthcare capacity inherently skyrockets because hospitals are finally freed from that massive glut of late-stage cases. Second, the economic savings are just astronomical. We're talking about shifting away from billion-dollar reactive treatments to affordable, proactive health. And finally, the whole society is transformed. Cancer becomes a manageable reality, not a guaranteed tragedy.
Ultimately, prevention is India's most underused yet absolutely most powerful weapon against cancer. We already have the tools to win this fight. The science is there for sure, the economics make complete sense, and honestly, the human cost of not changing is simply way too high. It really just requires the vision to shift our focus back to the very beginning of the timeline.
Take a look at the policies and the spending in your own community. Ask yourself, is your local healthcare system simply building more hospitals to catch people when they fall, or are they actively building shields to protect them from falling in the first place? Thank you so much for joining me for this explainer. Keep questioning the status quo, and I'll see you next time.